and researchers and practitioner researchers, help to support them in the delivery of their research. That's in helping to get their research, off the ground once it's funded, helping with things like participant recruitment, screening records, just helping them deliver their research projects. So I'm talking to you in that capacity today about home care research, which has its challenges. It doesn't fit quite easily into NIHR's structures. So I'll give you a few slides to talk about that. So this is a developing area, very quickly developing, and people like Irving and others are really at the forefront of trying to kind of get research into home care. So I just mentioned a few maybe previous studies, just to give you a context of what research is in this area. So it's important to say what research is, because people from outside universities, particularly practitioners and providers, etc., that are newly getting into research, sometimes they don't fully understand what research is. There's a lot of misconceptions, I think. So research is quite a broad church. It's quite it's really just applied knowledge to a practice area, very systematic. But it contains a host of different methods. So here's a previous NIHR-funded research project at King's College London. Monica Leverton there, the research fellow, was leading that, and we know Monica very well. That was a study looking at the role of dementia champions in the home care sector, so specialists, sort of trained home care workers that specifically focus on difficulties and challenges that people with dementia have and how to make them.
Sorry to interrupt, Paul.
Yep.
Your slides are not they're not quite visible. Do you mind if you can put them on share?
I'll put it on that. Is that better?
Yeah, that's better.
Yeah. I'll put it on that and then I'll go out of it if I need to do. Thanks, Irving. Yeah, Monica's research was looking at a specialist sort of role within home care, dementia champion. So this research was really interviews with people with dementia, interviews with home carers, and interviews with, family carers, informal carers. So research doesn't always have to be, like experimenting on people or brain scans, things like that. People worry about that they're going to have to take medication, or they're going to be experimented on, or they're going to be guinea pigs, things like that. So research is often in the social care sector, research interviews from researchers, surveys, collections of information, questionnaires, etc. So that's an example of that sort of research. I did some research quite a few years ago now, which was looking at family carers' views of home care in dementia. And this was a co-produced study with family carers, informal carers, as part of a charity which is called Together in Dementia Every Day. So a national charity that helps family carers really cope with the demands of caring for somebody with dementia living at home. So that again was interviews and a questionnaire with family carers. So research is quite a broad area. It doesn't always have to collect quantitative data. Sometimes it's quite qualitative, particularly in social care. So from the NIHR's point of view, the Research Delivery Network, I'll just try and describe some of the difficulties and challenges with home care in terms of research. And I think the biggest difficulty, the biggest challenge, I believe, with NIHR as a funder is that a lot of you might know the NIHR really began as an NHS funder nationally. It's probably the biggest research funder in England or the UK, and it's maybe the biggest in Europe actually in terms of its research funds and its infrastructure. But it began really live decades ago actually as an NHS funder, primarily research within hospitals in healthcare. Only recently, maybe over the past 5-6 years, has it developed into social care research in the social care sector, and it's now changed its name. So it's not the National Institute of Health Research now, it's National Institute of Health and Care Research. So it includes social care. but its structures are still sort of tied to the NHS and its funding. So it's sometimes difficult to fit social care studies in, and researchers and what I call practitioner researchers, which is people hopefully like yourselves, because there's no reason that a home care manager can't be a practitioner in research terms, and that's what we're trying to develop in NIHR. So those kinds of people in social care settings, they're quite unfamiliar with research, I think, and with what NIHR is. So I'm hoping to explain a little bit of that here. The professional groups, what we call the professional groups in social care, particularly people like social workers, of which yeah,
there's paperwork.
Sorry, I'll continue. I can't see you with this mode on, so I can't see who's speaking. Sorry.
You rang up saying you needed an emergency.
Sorry, that's somebody who just joined.
Package putting through.
Okay,
yeah,
okay.
just send
Somebody's
it through.
got the microphone on there.
I put it on the system. It's come up as Amballs, M23.
Right.
I'll just continue, Irvin, if that's okay. Professional groups in social care, people like social workers, for example. I've got a social work background. They're not really embedded in the research structures like clinicians are, for example, consultants and registrars in the NHS. They don't have specific research funding like NHS trusts have. So it fits uneasily, the structures really, into social care. Local authorities, which obviously commission some of your services. I know there's quite a lot of self-funders for home care now, but local authorities are the main sort of body that organise social care. They don't have R&D offices like NHS trusts have. So if there's a research grant that somebody's received, it's not as easy to sort of facilitate that as it is in the NHS. And quite a lot of settings, which applies to your setting as well, I think, home care, because of their statutory nature, home care is really allowed on statutory terms under the Care Act to support people living at home. Its commissioning is, and the whole financing of research, the way that costs are attributed to different parts of research, which is quite complicated, Irvin. I won't go into that here. That's not really sort of appropriately described sometimes for home care. So there's a lot of challenges which in the research delivery network we try and help people with once they've got a project set up, hopefully. We do try. So this is a little bit of an example of what we're trying to do in the Northwest RDN Research Delivery Network to tackle some of those challenges. So just as a broad overview, a lot of you will know this already, but for those that don't, home care is very important to research. I think it's under-researched. There are about 11,000 home care providers in England, and that's about a 700,000 person workforce. There are actually more home care providers in England than there are GP practices. And NIHR are used to supporting general practice research as part of NIHR, but home care is just as much a priority, I think, because of its reach, and it's quite extensive in terms of the number of providers. So we need to get into home care, really. We need to provide support to home care. There's a lot of opportunities out there. As some of you know, and I think Irvin's kindly put a little QR code on the agenda there for you. We've developed what we call a home care research engagement portal. The link's there. I won't go into the link now, but maybe Irvin could send these slides after the presentations and people can look at that. And you've got the QR code from Irvin there, really, as well as part of the agenda. Go into that. You can just click the link. There's an expression of interest form. You can register within that. It takes about 5 minutes to do that. And this is our attempt to have a kind of bespoke portal which introduces providers to research, what research is in home care. We're recruiting some home care providers for possible studies. There's some details of ongoing studies in there that require some input from home care providers, hopefully. There's a bit in there for interested researchers in universities who often do not know what social care research is either. So this is our attempt to increase future capacity for perhaps research bids in the future, projects that are ongoing now, and projects that are currently being planned by people like me, university investigators. So take a look at that. That's our attempt to try and increase this capacity. This is my last slide, Irving. Just some takeaways here. There's been lots of progress from NIHR. There's certainly the past 5 years in terms of their communications, getting the social care sector right in terms of the language. There's now increasingly very tailored support to individuals like yourself, Irving. I know you're interested in this. Research fellowships where you can get funded, backfilled your time to engage in research, part of your time. And that's been the case for clinicians over the years in the NHS, and that's the model we're trying to instigate in social care. There's more and more research application streams that are specifically for social care. The biggest recently is the research program for social care. There's a link there, take a look at that. That's specifically for social care and the social care sectors. There's still challenges in raising capacity due to the lack of tailored delivery approaches. We're trying to get to grips with that in the research delivery network. And there's many opportunities and some research projects now being planned, as I said, for submitting to NIHR in the future, including one by myself and another university where we're trying to look at perhaps evaluating a training program for person-centered care with home care providers. So please get in touch if you're interested in any of those things. You can go into the research portal. Please don't hesitate to email me at that email address there. I'd be pleased to speak to anybody and give you information if you need it. That's it, Irving. I'll try and end the slideshow there and I'll stop sharing if that helps. Thank you very much. Hopefully you could share these slides with the other slides if I send you them, Irving, afterwards.
Anything you can declare.
Thank you, everybody, for listening.
Thank you.
Thank you so
Dr.
much,
Paul.
Thank you.
Our next presentation is from Dr. Ivan. He's the Director of Pristine Health Solutions. Dr. Ivan, you may present. Thank you.
I don't think we can hear you, Dr. Ivan, if you're talking.
Right, sorry about that. Yeah, it's always technology always plays up. I've shared my slides. I hope everybody can see them. Can you see my slides? Confirm?
Yes, I can from this end.
All right, I'm gonna make them a little bit bigger. Thank you so much, Paul, for the presentation. And thank you, Melody, for the introduction. So Pristine Health Solutions, it's a home care service that is based in Middleton, Greater Manchester. What I would like to achieve by this presentation is to share with everybody our experience since we engaged NIHR. So this is based on our experience, but there could be more benefits of engaging NIHR, but we're going to share what we have experienced so far. So the aims of the presentation, we've got a research project that we have with NIHR. We managed to successfully bid for a project for what they call the strategic funding round for March 2025 to March 2026. And like Paul said, we are inviting providers to be on the home care research engagement portal, and would like to share training opportunities, which some Paul has already mentioned, and sharing about the support that we are giving to a campaign called Be Part of Research and Join Dementia Research, and would like to highlight how research can improve care. So like what Paul has already said, there is a home care research engagement portal, which is primarily to match home care service providers to research that is happening in the social care, including service users as well, because home care service providers, there are quite a lot in UK, like what Paul highlighted, and there is a lot that can be done in the social care sector that can improve their service, their outcomes, and that can improve even the well-being of their service users, and that can be achieved through research. And we think that there isn't much that has been happening in terms of research in the social care sector and within home care. And through this infrastructure that NIH is bringing up, there is a chance to embed research into day-to-day practice. And so part of what we are doing in this project really is to encourage home care service providers to come and join, be part of the portal. But also there are some trainings that are lined up. These are free trainings. For one is for good clinical practice. In short, it's called GCP. It's available online on NIH Learn. Links will be provided after the meeting. But these are free trainings that are available. And we will be going out to home care providers, sometimes sending out emails to home care providers about these trainings. And we think that is a good opportunity to learn the basics of research if you engage in such trainings, understand how service provision in home care sector can improve by getting involved in research, but also giving opportunity for not only service users, but staff and everybody as well to join campaigns like Be Part of Research and Join Dementia Research, which are actually portals which match researchers to research that will be happening across the United Kingdom. And it's not only meant for, if it's Join Dementia Research, it's not only meant for people that are, that are living with dementia. It's open to anybody. So any adult can be part of Join Dementia Research. They can just go on the portal, register on the portal, and be matched to any research that could be happening. Be Part of Research is quite a broad area of research that's happening in the UK. Once you have joined on the portal, you are matched to different types of research. You can choose which type of research that you'd want to participate in. And research is not always experimenting on people, like what Paul has already said. Sometimes it's just completing a survey, just giving feedback to a care that one is providing. It could be just doing an interview. And as part of our project as well, we would like to co-develop what we call a home care research toolkit, which we would want to gather input from service users, from home care providers, and from anybody in the community. And this toolkit should be able to just introduce what research is like. So it will be something like a leaflet, which anybody can read, written in basic terms, and anybody can easily understand what research is all about. So these are some of the activities that we have already started since we engaged with NIHR. We have done some face-to-face visits where we approach home care service providers, just talk to them briefly, maybe for a couple of minutes, 20 minutes, 30 minutes maybe, just discussing about research, how they can get involved in research. And we've got online meetings like this one, where we're just talking about research and any other opportunities that are coming from NIHR. And later on during the year, would want to have a research fair. And I know, home care providers, they're already doing audits, but sometimes there's no incentive to do audits other than just maybe showing to CQC. But there's a lot that we can do, maybe present those audits at a research fair and people can learn. Maybe we can get researchers to come and present outcomes of certain research that would have happened or opportunities for upcoming researchers. So it's a platform for the community, for home care providers, for service users and researchers to just come in one place and discuss about research. And of course, I've mentioned about the trainings, GCP trainings and other trainings that are coming from NIHR. And obviously, people would want to know what are the opportunities that are there. So like I said before, we are sharing what we have experienced so far, but there could be more. So we've got an NIHR certificate, which we proudly display in our office. Those that have been to our office, it's clearly visible. So, it shows that you are research ready. CQC, when they visit you for inspections, they can see that you are research ready, and that can, score you better with CQC as well, because CQC itself values research. And there are staff career development, and Paul has already touched on this one as well. In our organization, we're very fortunate because we have had opportunities for staff career development. And recently, one of our staff, Fungai, who is a research coordinator, she was admitted on a social care research internship, which will be starting in October. And that will be a great opportunity for her to interact with people that are already engaged in research. And it comes in with a salary buyout as well. So for the 1 day per week that she will be committing to research, NIHR pays for that day towards a salary. And it's a grant that can cover so many things, including enrolling for a degree program, let's say for a master's program as well. So that's quite a lot of excitement for us as an organization, and it offers an opportunity for carers within your organization, because workforce retention in the home care sector is a challenge. Maybe because people feel that once you're a carer, there's no way out, there's no way else you can, develop your career going. But when research, if you're involved in research, then these are opportunities for your staff, and that can help in retention. But not only Fungai, we're fortunate as well, because Silas, who is one of our colleagues in Pristine Health Solutions, also managed to get into that research internship. But there are many opportunities, including research champions as well. And for research champions, you are given opportunity to go out in the community and share more about research, promoting research within the community or social care sector. So these are opportunities, and there are many other career development awards that come from NIHR. Including pre-support funding, PhD funding. And, as an organization which is very keen on research, we are always looking for these opportunities. And that's why we are sharing with everyone that we need to grab these opportunities. And there is opportunity for service users as well to contribute to something meaningful, I think, that improves the whole sector, where they give feedback to researchers how things should happen in the home care sector. When managers contribute in interviews, like we've already contributed to an interview for a research. I think it was looking at into the data that we collect in home care services and how it can be used, or what else can be collected, or what else do you think it can be used for? So there are many opportunities that come with contributing maybe in an interview, in a survey, just sharing your experience on the ground. And of course, again, when it comes to the capacity, the question is always, are we ready to do research? I think many people would be asking in the home care sector, are we trained enough to do these things or to engage NIHR in any research activities? So, and one of the things that we have found to be very useful is that NIHR colleagues, they always come to our office to share about research opportunities, sharing flyers on what is happening. And there is also a platform where you can do free courses, which is called NIHR Learn. You can do free courses there. And like I said, there are career development pathways, and you can always learn through NIHR programs. And you can learn from experience as well. When you are invited to participate in a survey, when you give your feedback through interviews, you learn on what research is all about. So anybody can actually participate. You don't need to be somebody who has done a PhD or somebody who has done a master's degree to get involved with NIHR. They are open to anybody who just has a keen interest to do research. And of course, I've mentioned about these two important platforms that we are also promoting, and we've been sharing some flyers wherever we've been going, be it in the community, be it going to home care providers. It's Be Part of Research. I've already mentioned it's a free service where anybody, really anybody, from staff, from managers, anybody in the community, service users, they can just register and they can be matched to any research that they prefer or would want to participate in. There's also joint dementia research. Again, it's just a matching platform for studies that are happening in the specialty of dementia. So you can have a discussion with your service user about research. Just leave a flyer for them, and they can read at their own time. Then in terms of community engagement and research fairs, I think I've already said about this. It gives a platform for us to share ongoing studies. And we think when we are going to have a research fair as part of our project with NIHR, we would want to invite home care service providers to share about audits that they would have done. We are creating a platform for them to share what they are learning from service provision, so that it doesn't become only something that is internal. And usually people don't feel that there is incentive to that. But doing audits, if an organization is interested in doing audits, then there is a chance that they also have interest in doing research. So audits of course, they are not research, but gives that platform to actually do research. And of course, like I said, it's an opportunity to bring providers, carers, service users, and researchers to interact together. So the last part of our project will be a toolkit development, which is there really to guide providers on how to get engaged in research. It will be created in using simple terms. Even service users can just read through, and they can understand what research is all about certain home care services that are already engaged in research, and they would like to share best practices, or they would want to share their experience, getting involved with NIHR in research. And the outline is already there. What we'd want is feedback from providers on what they think research should be, or how they can, be involved, how best they can be involved with research. That's the main role of the toolkit. And again, this is the last slide that I have, and it's a call to action. It's a call for those that would want to get involved in research to just scan. So this is our internal portal. What happens is that once people have registered here, we then forward it to NIHR. We did that because we would want to know as well how much we are doing within our project, how much work we are doing, and how we can improve our project. So you scan that QR code. It's just a short survey, like what Paul has said. It won't take you even 5 minutes, just to collect details. And after that, we forward it to NIHR, and they'll get in touch with you, and you get involved in a lot more, knowing a lot more about research. I think that's all on my presentation. I really appreciate everyone for listening. Thank you so much.
Thank you, Dr. Ivan, for that presentation. It was insightful. Our next presentation is from Dr. Charlotte. She's an associate researcher at Manchester University. Dr. Charlotte, you can begin your presentation. Thank you.
Thank you so much. That's great. It's lovely to be here with all of you. Thank you so much for inviting me, Irvin. I know that I'm here because you've been supportive of our research project. So I think it's an example that you walk the walk as well as talk the talk. So thanks for having me. As mentioned, my name is Charlotte Hardacre, and I'm a research associate at Manchester Metropolitan University in the School of Social Care and Social Work. And I'm involved in a large research project with 6 other universities and 4 community partners called Our Digital Health, which is aiming to develop a measure of digital health participation alongside adults with intellectual disabilities. And so these are all the universities that are involved. And then we have the 4 community partners that are mentioned at the bottom. And I suppose it's worth mentioning that none of those are home care organisations. And I think our study would have been much strengthened if it had included people, managers and practitioners from home care. So perhaps we can get into that in the question and answers later. Okay. Let me see, make sure it's clicking along. This is all the team, just to give you a sense of how large the project is and how enormous some of these really well-funded projects can be and how much good work we can do with all the people involved. So we're aiming, as I said, to learn about the digital health participation of people with intellectual disabilities. We're funded by the NIHR, and it's started in 2023, and the project's going to run until September of 2026. And there's Liverpool John Moores are the lead organisation. The principal investigator is based at John Moores. And then, as I said, there's 4 of the universities alongside some community partner organisations involved. And I suppose I should mention, what do I mean by digital health before we get going? So what I mean by digital health is that it's the way that we use technologies like phones, tablets, computers to support our health and well-being. And that can be everything from using your phone to book your doctor's appointment, ordering new prescriptions via your phone, but right the way through to watching YouTube for your health and well-being, to relax, to unwind, playing games to relax and unwind. And so we've been going out and talking to people with learning disabilities about how they use technology for their health. And why does that matter? Well, I think, as we probably all know in this meeting, healthcare is increasingly moving online. And we know that people with learning disabilities face greater digital exclusion. So they have lower levels of access to technology, lower levels of digital literacy. And alongside that, they also have lower health literacy. So maybe being able to spot signs and symptoms of health conditions, but also they have higher health needs. So greater rates of things like thyroid conditions, mental health conditions. And so for that reason, digital health is particularly important for this community. And of course, with the group that we're talking to today, home care services are obviously on the front line of supporting people's access, use and participation of technology. And so they're important collaboration that we should have in order to carry out our study. And we haven't always met the mark there, so it's great to be able to talk to you today. So just to give you a sense of this study, as I say, it's quite a large scale study. So part one is the development of a digital health participation measure, by which I mean a survey, right? So we created a survey and we did that with people with learning disabilities. So we started off by having some focus groups and we co-created questions and we made sure that those were accessible. So that means that our survey is in easy read. So it has images, it has straightforward language, and we have a range of versions of it. We have an audio version, we have a proxy version where a carer or parent can complete the survey on behalf of the person with learning disabilities. We also have supported completion versions where they sit with a researcher who supports them to answer the questions, as well as independent completion. And so that was all done in a co-production way. And I think, like Paul was saying earlier, these are ways that people from organisations like the ones that you work at can be involved from the very outset, the design of research, and perhaps should be partners in bids as well, of course. So once we'd created that survey, then we then set out to complete the survey with 400 people across the country. So it's a national study, and that's where we're at the moment. So we've got the survey created through the co-creation process, and we've now completed time point 1. This is a longitudinal study, which means that the people are completing the survey twice at 2 different time points, 6 months apart. And we've completed time point 1 with everybody apart from the proxy participants. So everyone that was completing it independently or with support has now completed the survey for the first time. So that's 400 people nationally. And we've been going to places like residential care homes to do the survey with people. We've gone to day centres to do the survey with people. We've gone to supported living settings. But we've very rarely had the survey completed by people in their own home independently. And that was perhaps a gap where we could have collaborated more effectively with the home care sector. Once people have completed the survey twice at those 2 time points, there's then going to be a digital diary study, which means that and also I should have mentioned actually that when people complete the survey, they're paid to do so. So every person with a learning disability that completed the survey received £20 for their participation. And I think that's, again, another example of how the NIHR really encourages a non-extractive approach to research. By which I mean not just going and taking, it needs to be kind of like Irvin was saying before, mutually beneficial. The people that are involved, including like the managers, the practitioners and the participants, should gain from being involved in a research project. And that is very much part of our ethos and values as a research team. And so it was important to us that we didn't just go, right, fill our survey and see you later. No, there was a payment and there's an important expectation, and actually that will be held to account, that we return and explain what we found out, and we work with the participants to disseminate and to improve on the findings that we receive at the end of the study. So that payment at that stage, but then also as the digital diary part of our study, that also means that people receive a tablet to keep forever. So 40 participants, so 10% of our 400 participants will receive a tablet to keep forever. But part of that kind of back and forth, that collaboration, is that for 5 months of that first of them receiving this tablet, they'll be keeping a diary of how they use technology for health. So maybe they'll go to their doctors and they'll snap a picture of them checking in, you know, on the screen that you use at the doctors. Snap a picture of that. They might snap a picture of being frustrated, but when they're using a piece of technology to, I don't know, order their prescription. And then they can write or record by voice recording a reflection on how it felt to engage with technology for health. And throughout that process, we'll be keeping in touch with them by telephone or in person to find out how they're getting on. And that would be, again, a really great moment to collaborate with home care workers to support people to participate meaningfully by having someone that they know well or understands their life alongside the researcher, who often won't know them well. And then the last part of the study is that co-creation of guidance. So again, we'll go back and we'll run workshops to develop guidance and to improve our measure so that it's valid for future use, so that other people beyond our study can use that survey of digital health participation with other populations. And that, again, we'll be co-producing that. And those workshops will take place in advocacy organisations and in residential settings, like care settings. But again, there could be opportunities to collaborate with home care providers to perhaps put on a workshop in a community setting. And those things are all to come in the study. So, you know, my email details are at the end of the presentation. I'd love to work with people for the rest of the project. And so I think, you know, I've probably mentioned it in the previous slide, but the role of services for us are that advocacy organisations, day centres, residential care homes and home care organisations have provided participants for us, have worked with us, and they've enabled, you know, trusted access for recruitment. They're people that are known to our participants and can encourage them to ethically, with full consent, join in. And they've also really helped with creative and accessible methods. You know, people can tell us that language doesn't quite work. This environment is a little unsettling. It's not relaxing. It's not calm. It's not appropriate. So that dialogue improves the quality of research exponentially. But as I've already mentioned, home care has been less visible than we would have liked, and that's not a criticism. That's something that we need to take on board as the research team to improve for the future projects. There are some real strengths I've probably mentioned already, in that people have been able to participate that would have been excluded, you know, that's why I'm here today, because Irvin collaborated with SACPA, my colleague. They've ensured that supported completion has been administered effectively. They've provided those safe and trusted spaces for people to take part. They've helped make sure that we've got creative methods. So we've had things like digital health bingo at settings that have been fun and made the research process less onerous, less intimidating. They've shared some really essential insights about practical barriers, like devices being complicated, Wi-Fi being patchy, having time within the working day to support people, having confidence in our own digital skills. Those have been invaluable. And they've acted as real genuine partners in shaping the research, not just gatekeepers, not saying no, actually working hard to include and encourage people to participate, which has been really helpful. But there are those gaps and opportunities. You know, what we've done is we've leaned in too much into the day centres, the advocacy organisations, and we've only had a minimal amount of supported completions through home care staff. So we need that direct involvement to make sure that people are involved in focus groups, in the workshops, and in the survey design that's to come. And we really don't want to have people that are living in their own homes and don't go out and engage with daytime services to be left out of digital health participation research. That is an enormous gap that we can't allow to happen, which means that it's great that there's opportunities ahead to build some stronger ties. I think this is how it happens, by coming to meetings like this, particularly I think as partners in submitting future bids. You know, we have a research group at the Manchester Metropolitan University, and we'll always be open to submitting as partners. so that it can happen from the outset. And I think, involving home care staff and clients more directly in future survey rounds and in that co-design and dissemination activity that I've mentioned. And just as I close my talk, just to mention what are the things that we've learned about digital health participation from this large-scale study. We've learned that digital health goes beyond just looking up your symptoms online. It happens across multiple devices. People have many devices. I think we were limited in what we expected people to have in their homes. Lots of people are wearing wearable devices. Lots of people are using voice commands. Devices are really popular. And that digital devices are contributing to health across a lot of different areas. For example, by increasing independence and autonomy, allowing people to travel independently in a way that they might not have been able to on their own. And these are all parts of digital health that we may overlook. So what's next? Well, 100 proxy participants still need to complete the survey at time point 1. And this could be a real opportunity for the home care sector to complete surveys on behalf of people. The people will get the £20 per payment, and it will strengthen our ties. It will build all the skills that Irvin was talking about earlier. We also have the 40 participants who will receive the tablets. That's still to come. And there's the workshops and co-production that's going to happen in the future, and it would be great to be involved with the home care sector for that. So if anyone wants to connect or collaborate, the website for the project is there. My email address is there. In my research team, we've just won another bid for an AI project, co-designing AI with people with learning disabilities. That's just been funded. It starts in March, and it's another project that we could potentially collaborate with you on. And that's me. Thank you so much for listening.
Thank you so much, Charlotte.
My pleasure.
Right, Melody.
Thank you so much, Dr. Charlotte, for the presentation. Are there any questions? And also, I'm going to be sharing that QR code in case there's anyone who is interested and they haven't registered yet.
I had a question for
Thank
Paul,
you, Dr.
actually.
Charlotte.
Oh, sorry, no, go ahead. Yep.
Thank you, Dr. Charlotte, for your presentation. I just wanted to know, were there any dropouts? What was the rate? And also you mentioned that 40 were selected to be given tablets. Out of the 400, how did you choose the 40?
Yeah, brilliant question. So out of the initial 400, so they have all completed. Now we're doing time point 2. I think one of the reasons why we don't have dropouts for people that, may say they want to do it and then don't drop out is because of the supported completion and the support we have from our partners to help people come to the settings, to help them complete the study. But for time point 2, yes, we have had some dropouts. So in Manchester, we had 100 people fill in the survey and we've lost 16. And that's because they didn't return back to the day centre where the project was happening. And that's for lots of different reasons. People moved, people found the survey long. It's long, our survey. And that means that they won't receive their £20 participation payment. And so we have done our best to ring round to encourage people. And I think, again, partnership is one of the ways that we would reduce dropouts from the study. And then for your second question, for the 40 people, how did we choose those? We worked with our partner organisations to select a mixture of people from different demographic backgrounds because we wanted some representation of different communities in the study and different degrees of tech skill. So people who maybe had very low levels of tech skill and higher levels. So that's how we selected. There was a purposive approach. We were looking for particular groups to be represented. So we had some criteria for that. We agreed those criteria again with partners because we have a co-production. We try to be quite collaborative. We took advice from our steering committee and from our collaborators, our partners.
Thank you.
Pleasure. I had a question for Paul. I was wondering, Paul, how what's the best way for home care organisations, community partners to get involved at the bid stage of NIHR funded projects?
Yeah, hi Charlotte, great presentation by the way. Yeah, this is a good question. It's a bit like you said, Charlotte. At the moment, because home care is so undeveloped in terms of research, you get involved by doing things like this. It's building up that network of links, Irving, as you're doing with academic researchers, providers, and sort of counsel anyone to, if you're interested in research but want to be more a part of it in terms of joining a research team, then you can always email me, because I do have knowledge of research projects that are in the planning stages. And if you're interested in that, hook up with people. And IHR are really keen on not having, in the old days, a decade ago maybe, it was just the great and the good professors and things on research bids. It was a bit of a status obsessed kind of idea. But NIHR certainly not interested in that now. They want research teams to reflect both the population that's being researched, if that's the right words, and also the mix of skills necessary to conduct the research. And in home care research, you really need a provider manager or a practitioner on your research team. I think if the research is about home care or set in a home care setting, organisation, or multiple organisations, especially if the project runs across multiple sites of providers, for example, crucial, I think, to have a home care manager as what we call a co-investigator. And that will be funded by an IHR. So when they do the costings for the research, that provider manager will have a little bit of a backfill of their time to provide input into the research, just as we do as researchers. That's what happens. We're costed for little bits of our time. And they're very keen on that. So it's starting from this base, Charlotte, at the moment, sort of informally. There isn't a structure yet like there is in the NHS, the way you contact your R&D office and get involved, because there's no R&D offices in home care providers, is there, Irving? Unless, you're a little mini R&D office, Irving, at the moment, but there's no real structure to it, is there? Hope that answers your question, Charlotte.
All right. Yeah, so we just left with about 4 minutes in the meeting. Thank you so much for the presentations. Is there anybody who wants to ask a question? Anybody, any question from the chats? No?
I'm interested to know, in the group that we have here, are there any things that make you feel encouraged to participate in research or discouraged? I don't know if people could put it in the chat or shout out, but I'm just wondering what makes you fancy it and what puts you off. That's just me being nosy, because I think it would help. Because my experience has been, it's been like very serendipitous. If I do some work with a project, with an organisation, we become friendly, and then they come into my next bid, and that's just not fair. Workload, yeah, that makes sense. And maybe that's where the backfill that Paul mentioned is that, we cost in. It's really important, I think, when we write a bid to cost in time, but that, even with the costing, maybe there's not enough staff to fill in. Workload.
Could I just make a comment, Irving, about workload? So part of the reason why the research delivery network that I explained was set up, and it used to be called the Clinical Research Network, if people are as old as me and remember NIHR as it's developed. Our job in the Research Delivery Network is to help the research teams deliver their research. And if that means helping the site, for example, a home care provider organisation, if that means helping the site with arrangements for example, allowing researchers into your organisation to meet with people, doing a lot of the preliminary work of the researchers in terms of perhaps maybe, like screening, helping you screen records, for example, to identify particular clients that the research is focusing on, for example, perhaps people with dementia. The RDN can help with that. We have something called a direct delivery team, or an agile team, we call it now. And that's some of the members of that team are on this call here. And we go into organisations to help you interface with researchers and deliver the research, as well as help the researchers at universities deliver the research. So there are teams of people that are paid to help you. So maybe that might sort of just help with a little bit of the workload and paperwork, etc. Hope that helps. And it's free to you. You don't pay for that. It's paid for by NIHR. Margaret's got her hand raised.
Hi everyone, my name's Margaret. I'm one of the clinical research practitioners from the Agile delivery team that Paul's just spoke about. And I can say I've had personal experience of going and working in care home settings out in the community. So going out and working with care home providers would be really nice. And we're here to help if you need help.
And that's a good point from Shani, that it's a lot of information, and when we're newer to research, sometimes we can talk at cross purposes, we can lean into the acronyms, just like we can in all of our respective fields where you're an expert in and so that is something that we need to work on to bridge and not talk at cross purposes.
All right, thank you. It's now 11 o'clock. Which is our end time for the meeting. We will share the slides. There are some people in the chat who are saying, can we have the slides? We'll share the slides. I'm sure, so there's another, I'm still trying to process all the information regarding research. I'm completely new to research. And I'd love to know more so I can put in support research with our service. So this is coming from, so there's somebody who is in the GP care who would want to receive support. I think Margaret, probably you can take up that one.
Hi, or maybe Emma would be able to help.
All right, yeah. So how can they get to know your contact, or you can just put them in the chat there?
Yeah, I'm Emma. I work with Margaret and Paul. I'm happy to put my email in the chat now. If is it Shani wants to reach out?
Yeah, maybe, yeah. Okay, all right. Yeah. So we are planning to have these meetings quite regularly, and there's quite a lot of interest that came from the home care sector when we sent out about this meeting. So we think we should be able to do these meetings quite regularly, and that would help build the structure that we want into the home care research. So yeah, we are going to organize another one in a month's time, and we'll share out the invites. All right, right. Thank you, everyone, for joining in this meeting, and thank you, Paul. Thank you, Charlotte, for the presentations. Hope to meet next time. Thank you. Have a good day.
Thanks,
Thank you,
everyone.
Irving.
Bye.
Take
Thank
care.
you.
All.
Thank
Thank
you.
you.
Bye.
Bye. Bye,
Bye.
everyone.
Thank you.
Comrade.
Hi, comrade.
Can you hear me?
Yes, there's still a few more people who are leaving the platform. Okay. Yeah. Oh yeah, I think everyone is left now. Yeah. All right, let me just, sorry, I was recording, sorry. Let me just